My dear friends, imagine waking up one morning and not recognizing your own grandchild's face. Picture sitting in a room full of family and feeling like a stranger in your own life. This isn't just a fear. It's happening to someone right now, every 66 seconds in America. But here's what might shock you. What if I told you that the very medications sitting in your medicine cabinet, the ones your doctor said would keep you healthy, might be quietly stealing your most precious memories? I'm here today not to frighten you, but to empower you with knowledge that could save your mind. My name is Host Name, and for the past 15 years, I've been helping families navigate the complex world of senior healthcare. What I'm about to share with you comes from my heart, backed by the latest medical research that 99% of seniors have never heard about. If you're over 60, or if you love someone who is, please don't click away. The next 25 minutes could be the most important investment you make in protecting your mental clarity and independence. Because what I'm about to reveal isn't just about medications. It's about reclaiming your right to age with dignity and a sharp mind. Before we dive in, if you care about protecting yourself or your loved ones, please hit that subscribe button and ring the notification bell. This information needs to reach every family dealing with aging, and your subscription helps us spread this life-saving message. Let me paint you a picture that might feel all too familiar. A vibrant 72-year-old grandmother from Ohio began noticing she was forgetting where she put her keys. Then came the missed appointments, the confusion about which day it was, and the frightening moment when she got lost driving to her daughter's house, a route she'd taken hundreds of times. Her family assumed it was just normal aging. Her doctor suggested it might be early dementia. But here's what nobody considered, was taking 5 different medications, and 4 of them were quietly working together to shut down the very brain chemicals responsible for memory and thinking. This isn't fault. It's not your fault if this sounds familiar. We live in a medical system that often treats symptoms without considering the bigger picture of how multiple medications interact in our aging bodies. The pharmaceutical industry has known for decades that certain common medications can accelerate cognitive decline, yet they continue to profit billions of dollars each year from these very same drugs. A groundbreaking 2023 study published in Neurology and Aging Research found that one class of medications increased dementia risk by 49% in seniors within just 2 years of use. But here's the hopeful part that I want you to hold on to. Unlike Alzheimer's disease, medication-induced cognitive decline is often reversible. When we identify the problem medications and work with your doctor to find safer alternatives, many people experience remarkable improvements in their memory, clarity, and overall quality of life. Now, let me walk you through the 9 most dangerous medications for your memory, starting with the ones hiding in plain sight in almost every senior's medicine cabinet. Oh, that little pink pill that sits on your nightstand. Seems so innocent, doesn't it? It helps you sleep, calms your allergies, and you can buy it anywhere without a prescription. But inside your brain, it's blocking a crucial chemical called acetylcholine. Think of it as your brain's memory messenger. Every night you take for sleep, you're essentially telling your hippocampus, your brain's memory center, to slow down. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors using these types of drugs regularly had a 54% higher risk of developing dementia. I know sleep is precious when you're dealing with the aches and changes of aging. Instead of reaching for, talk to your doctor about melatonin or consider newer allergy medications like that don't cross into your brain. These purple pills promise relief from heartburn and acid reflux. Many of you have been taking them for years, maybe even decades. But here's what's rarely discussed. These medications are preventing your body from absorbing vitamin B12, the nutrient your brain desperately needs to stay sharp. A comprehensive study of over 73,000 people aged 75 and older found that regular PPI users had a 44% increased risk of developing dementia. These drugs don't just reduce stomach acid. They interfere with your body's ability to absorb the building blocks of healthy brain function. If you're taking a PPI daily, don't stop suddenly. Your symptoms will return with a vengeance. Instead, work with your doctor to gradually reduce the dose while trying alternatives like H2 blockers such as, or natural options like licorice root. Nobody wants to talk about bladder control, but it's a reality for many seniors. Medications like promise dignity and freedom from embarrassing accidents, but they work by blocking the same brain chemical that targets, and they cross into your brain even more easily. A 2019 BMJ study found that people over 65 who took these strong anticholinergic medications for more than 1 year had a 49% higher risk of developing dementia, nearly 1 in 2. I understand the trade-off feels impossible, your independence versus your memory, but newer medications like work differently and are much safer for your brain while still providing effective bladder control. These cholesterol medications are among the most prescribed drugs in America. They've prevented countless heart attacks and strokes. But here's what many doctors don't discuss. Your brain is nearly 60% fat, and cholesterol plays a crucial role in protecting your nerve pathways. When you aggressively lower cholesterol, you might also be starving your brain of what it needs to function. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 on statins for more than 3 years had a 26% higher risk of mild cognitive impairment. Balanced perspective: I'm not saying abandon your heart health. That would be dangerous. But if you've been on a statin for years and noticed increasing forgetfulness or confusion, talk to your doctor about whether a lower dose or a brain-friendlier statin like might work for you. Lorazepam, Ativan, diazepam, Valium, alprazolam, Xanax. These medications can feel like lifesavers when anxiety or panic overwhelms you. They quiet the storm in your mind and help you sleep, but they're also creating a dangerous dependency while slowly dimming your mental light. A 2022 BMJ study following over 8,000 seniors for 6 years found that those using benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. If you've been taking these medications, please don't stop suddenly. It can be dangerous. Work with a doctor who understands safe tapering. There are alternatives like for anxiety or cognitive behavioral therapy that can help restore calm without stealing your memory. This older antidepressant is still commonly prescribed for pain, sleep, and even migraines. It seems like a miracle pill that handles multiple problems at once, but it's also one of the most potent anticholinergic medications still in use today. A massive 2015 JAMA internal medicine study of over 3,400 adults aged 65 and older found that those taking higher doses of anticholinergic medications like amitriptyline had a 54% greater chance of developing dementia over 10 years. Hopeful guidance for nerve pain. Medications like or may provide relief without the memory risks. For sleep, low-dose melatonin or a much milder option like might work better for your brain. Looks like any other modern antidepressant, and it's prescribed millions of times each year for depression and anxiety. But unlike its SSRI siblings like, or has significant anticholinergic properties. A 2021 study in Frontiers in Psychiatry found that elderly patients taking showed measurable declines in short-term memory and attention within the first 12 months, and were 30% more likely to show early cognitive impairment. The American Geriatric Society has actually placed on their Beers criteria list medications potentially inappropriate for older adults. If you're taking it, ask about switching to safer alternatives that don't carry the same memory risks. This category is especially heartbreaking because many seniors don't even know they're taking antipsychotic medications. Drugs like, and were designed for serious psychiatric conditions like schizophrenia. Yet today, they're routinely prescribed in nursing homes and hospitals for seniors who are simply confused, restless, or difficult to manage. It's chemical restraint disguised as medical care. A 2022 study in the Lancet Healthy Longevity found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months. These medications suppress dopamine, a chemical critical for memory and executive function. They turn vibrant personalities into shadows of themselves. If you or your loved one is on one of these medications, demand to know why and explore non-drug alternatives first. The most dangerous situation isn't any single medication. It's taking multiple anticholinergic drugs at the same time. Imagine taking diphenhydramine for sleep, for bladder control, and amitriptyline for pain. Each one might cause mild problems alone, but together they create a perfect storm. A 2022 study in Age and Aging tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the normal risk. The hopeful news: this is completely preventable and often reversible with proper medication review and management. If this information is opening your eyes to risks you never knew existed, please subscribe and share this video with anyone you care about who's over 60. Knowledge is power, and together we can protect the minds of the people we love most. Now, I don't want to leave you feeling helpless or afraid. Everything I've shared with you has a solution, and you have more power than you realize. Step 1. The medication audit. Gather every single medication you take, prescription, over-the-counter, supplements, everything. Create a complete list with doses and frequency. Don't forget about those as-needed medications you take occasionally. Step 2. The brown bag review. Schedule an appointment with your primary care doctor or pharmacist specifically to review all your medications. Bring everything in a brown bag if you have to. Ask these specific questions. Which of my medications have anticholinergic properties? Are there safer alternatives for any of these? Can we reduce doses on any medications? Which ones are absolutely essential versus convenient? Step 3. The gradual approach. Never stop medications abruptly. This can be dangerous. Work with your healthcare team to create a plan for gradual reduction or substitution. Some changes might take weeks or months, and that's okay. Step 4. The natural support system. While you're working on medication changes, support your brain with regular B vitamin supplementation, especially B12, adequate sleep hygiene without anticholinergic sleep aids, mental stimulation through reading, puzzles, or social interaction, gentle physical activity appropriate for your abilities. Here's what gives me the most hope to share with you. Medication-induced cognitive decline is often reversible. I've seen 80-year-olds regain their sharp wit and memory within months of reducing their anticholinergic burden. Your brain is more resilient than you've been told. Let me tell you about Robert, an 79-year-old retired teacher who came to see me because his family was considering memory care. He'd been taking 7 different medications, 5 of which had anticholinergic properties. He couldn't remember his students' names, struggled to follow conversations, and had stopped reading, something he'd loved his entire life. Working with his doctor, we gradually reduced his anticholinergic load over 6 months. We switched his sleep medication, changed his antidepressant, and found a different approach to his chronic pain. Today, Robert is back to reading 2 books a month and teaching Sunday school at his church. Or consider Helen, whose family thought they were losing her to dementia. She'd been taking nightly for 3 years for sleep, along with medications for bladder control and depression, all anticholinergic. Within 4 months of medication adjustments, her daughter called me in tears of joy. "I have my mother back." These aren't miracles. They're the natural result of giving your brain the chance to heal when we remove the chemical obstacles to clear thinking. If these stories give you hope, please subscribe to our channel and hit that notification bell. We're building a community of informed families who refuse to accept cognitive decline as inevitable. In the comments below, I want you to share. Which of these medications are you currently taking? Have you noticed memory changes, since starting any new medication. Will you commit to having a medication review with your doctor this month? Your story matters, and sharing it might help another family recognize a problem before it's too late. My dear friends, as we come to the end of our time together today, I want you to remember this. You are not helpless. You are not destined to lose your mind as you age. You have the right to ask questions, demand answers, and make informed decisions about your health care. Your memories are precious. They're the stories of your life, the faces of the people you love, the wisdom you've gathered through decades of living. They're worth protecting and they're worth fighting for. Don't let anyone, doctor, family member, or friend, convince you that confusion and memory loss are just part of getting older. Sometimes they are, but sometimes they're a cry for help from a brain that's being chemically suppressed. You have the power to advocate for yourself or for someone you love. You have the right to a second opinion, to ask for alternatives, and to demand that your quality of life matters as much as the number of years you have left. Take what you've learned today and turn it into action. Make that appointment. Ask those questions. Review those medications. Because somewhere out there, another Robert, another Helen is waiting for someone to connect the dots and give them back their sharpest years. Age with dignity. Age with clarity. Age with the wisdom to know that you deserve both. Thank you for watching. Thank you for caring, and remember, your best days of mental clarity might still be ahead of you.